Good morning. Welcome back to my channel. I'm Dr. Christine Rankin, the doctor here at South Metro Wellness Clinic, our chiropractic and massage practice located in the heart of Burnsville, Minnesota. I just wanted to wish everybody a happy new year. Today is the 31st. I hope you all have some exciting, fun plans here for New Year's Eve, as it'll be certainly a new beginning tomorrow morning. We did have a serious amount of accidents that happened last week on Saturday morning. We had an ice over here in Minnesota. 408 accidents were recorded. I don't know how many of those accidents were with injuries, but this relates back to the last video we did where we talked about how important chiropractic care is after work injury or after a car accident. So I hope that everybody got a chance to see that one. Today we're going to talk about chiropractic myths. There are a lot of them, unfortunately, and a lot of our first-timers here in the last month have had a number of questions with certain fears and certain apprehensions about why should I do chiropractic care. They don't teach how important chiropractic care is or what spinal hygiene is in school. They teach you how to brush your teeth and how to go see a dentist, but they don't necessarily talk about spinal hygiene. So we're here today to debunk some of those chiropractic myths. The first one I'm going to start with is that chiropractic doesn't work or it didn't work for me. It's extremely common for me to hear this, and this is actually a very difficult question to answer because there are so many reasons as to why chiropractic may not have worked for that person. It could have been a lack of connection with the doctor. It could have been a lack of education. It could have been a lack of understanding on either the portion of the patient or the practitioner. Don't exactly know, but a lot of things can happen when it comes to people feeling that chiropractic didn't work for them, meaning they came in with a certain level of expectation and those expectations were not met. Meaning I'm coming in, I want to make sure that my chiropractic care is effective, I want to get out of pain, I want to get out of pain as soon as possible, and I want everything to be correct and I don't ever want to have to come back again. And unfortunately, that level of expectation as a practitioner and a provider is a little bit exceedingly high. And by a little bit, I mean a lot. There's absolutely no way I can satisfy absolutely everyone's needs in a very, very short amount of time and promise them that absolutely none of these problems will ever come back again. And I think that it really comes down to having a good quality conversation with that person as to what their expectations were and why they were not met. My first chiropractic mentor, her name was Dr. Amy. She used to practice out at Chiropractic USA in Long Lake, Minnesota, way back in 2010 when I was a wee little intern just learning. And she said, our first job is to lead, teach, love, and serve. So if we lead, teach, love, and serve our patients, we're going to find out exactly what it is that they need and why they're there. The last thing I want someone to do is walk away from my practice feeling dissatisfied with their results, or walking away feeling that chiropractic care doesn't work or it didn't work for me, and then carrying that message over into the next portion of their life or the next doctor that they visit with those same hurt feelings or that same level of expectation that was crushed. So Dr. Amy taught me, have you ever had a bad haircut? Have you ever seen a bad dentist or a dentist that you didn't click well with or didn't do quality work that you liked or didn't make you feel like you really were satisfied with the services? And the answer is yes or yes. We've all had that experience where I've had several bad haircuts. You can't go the rest of your life without getting another haircut. You have to find a new stylist. Not every chiropractor is created equally. We are not all the same. Every office is different. This is a very beautiful thing about chiropractic, but it is also negative too that there is no industry standard, so the level of expectation varies depending on who you are, what you're looking for. And so I really bring this hone in on education and communication and merely being able to connect with your doctor and being very, very honest. When you go in to see a new chiropractor, this is extremely important. It's really like an interview. I don't know if everybody knows this, but there is no charge to come in and just have a consultation. If you're looking for a consultation and exam, depending on what you're looking for, and there are a couple variables there may be a charge for the exam portion, but there is never a fee to just come in and chat. When you meet with a new practitioner, especially in chiropractic, many of my chiropractic colleagues do not charge for that. A consultation is a chance to get to know somebody and squash some of those myths and squash some of those expectations that were not met and really put some facts on the table and decide about whether or not this is a good fit for you. Not every person who comes into my office is a good fit for me. I'm not everyone's favorite doctor. And if I'm not, that's perfectly fine. I'm wonderfully okay with that. I'm happy to make a referral and let that person find a doctor who is appropriate for them, even if that's not a chiropractic practitioner, even if it's a medical doctor. Now, we have a fantastic medical doctor here who specializes in pain care. His name is Dr. Aurora. I refer patients to him pretty much on the regular, I would say a couple times a month, because they just were not willing to do chiropractic care. The work that it was going to take and the time that it was going to take to get better was not right for them. So it simply was not going to work. And I thought that medical care would be a more appropriate way to manage their pain, and that chiropractic was not a good fit. Wonderfully okay with that too. When you come in, it does not take 3 hours of your time or even an hour of your time. I'm going to show you what my intake form looks like. It's actually very, very simple. I don't know if we can hone in on this, but this is my new patient health history form. I don't know if we can get a pretty good shot of that. It just gives people a good idea that this is not a half an hour long. It takes less than 10 minutes to fill this out. Okay, we've got basic health history, basic information. We've got some physical examination pieces. When was your last physical? What are your habits? Habits are very, very important. That's what I'm looking for. I want to know who you are, not just what your pain symptoms are or what your x-rays look like. Those are technical pieces that are important, but I want to know who you are. I'm treating a person. I'm changing someone's life. I want to know what's going on behind the scenes, and it's nearly impossible for me to collect all that information just on a piece of paper. Okay, this is my favorite piece, the body. But yep, this is it. This is 3 pages long. I take a copy of your medical insurance card and your ID so I know who you are. We do not use social security numbers to verify insurance benefits. We only use date of birth. So that's actually very simple. We are much more cognizant of privacy that way. But when it comes to coming in and finding out if chiropractic can help you, I don't believe there should be a charge. This is the most affordable, accessible form of healthcare on the planet. And it should be available for everybody who wants it without having to be worried about getting through the door and having it cost an arm and a leg. It's actually not true. Another myth that people bring in, or that they're concerned about, and this actually happened about a month ago around Thanksgiving. This woman had a shoulder concern and she was going to do physical therapy. She'd gone the medical care route, and she just wanted to know that if she came in and did chiropractic care and she paid this much money for this many visits, that she would absolutely be cured. On my honor, I could not promise her that she would be completely cured and she'd never have to come back and do it again. And I just want to hear that. Unfortunately, there's absolutely no possible way that I could promise her a cure. There's actually no such thing as a cure in chiropractic care. If I were to promise you as my customer or my patient, the consumer, that I could give you a cure and that you would never have to come back and visit me again, I could get in trouble with the Minnesota Chiropractic Board. Cure is not a word that we can use. The proper term is completely medically recovered, or have made a complete recovery, where you're pre-accident status or pre-injury status or pre-condition status, where you're as close to your perfect normal health as humanly possible. That's different than a cure. Cure does not exist, okay? There's no possible way that I can promise somebody who has an existing condition that they will not have to continue chiropractic care, or that I can promise results. This is a practice. It's not a guarantee, okay? So that's another very interesting thing that people come in with. No such thing as a cure, complete total recovery. If I start going to the chiropractor, I will have to go for the rest of my life. This is my favorite one and probably the oldest one. It's been going on for a long time, ever since I was in high school, considering going to chiropractic college after my stint with University of Iowa. Man, if you have to start going to a chiropractor, you have to go for the rest of your life, or that you're going to get addicted to it, or that it's some kind of self-fulfilling prophecy. I've heard that brought up as well. Those things are completely false, totally, completely, 110% untrue. If people were addicted to chiropractic, the offices would be so full we would have to shut the doors and kick people out, okay? It does not work like a drug. Chiropractic is more of a lifestyle wellness choice, okay? It's something you do to maintain your health and to make sure that you're restoring whatever problems that you have. Once your body has a history and it knows where it keeps stress, when stress comes back into your life, that stress pattern will repeat itself, because that's how your body responds, okay? We live in a physical world. We're going to have bumps and bruises and misalignments and things that happen. That's not uncommon. It just is not appropriate to tell somebody that if you discontinue your chiropractic care after you've gotten good results, you don't have to expect to ever come back. The reality of the situation is, once your body has that history, it will repeat, it will go back. I explain it to people like this. If you stop taking your medications for blood pressure, do they work? The answer is absolutely not. If you stop taking your drugs prescribed by your medical doctor for a medical condition, they will not work for you. If you see the scene of an accident and you have to call 911, and if you just failed to call 911 or thought you did or forgot, they're not coming 100% of the time. That's the law. So if you stop doing what works or you don't do what you should do, you don't get the result and therefore have to unfortunately suffer the consequences. If you stop eating a healthy diet that helped you lose weight, you will put the weight right back on. If you stop going to the gym, you will lose your muscle memory, you will lose your muscle mass, you will lose your tone, and you will have to work very hard to bring it back. It's very, very simple. You don't get to keep what you don't maintain, because maintenance is the law of life. And if you want to hear a little bit more information about that, you can visit my blog at southmetrowellness.com. One of the first blog posts I did about 1.5 years ago was how maintenance is the law of life. One of my favorite concepts, and I also learned that from Dr. Amy as well. So thank you, young lady. She did a lot for me. So moving on, adjustments hurt. Actually, no, they don't. The adjustments are painless. A lot of people want to know, what's that sound? Are you going to crack my neck? No, I'm not cracking your neck. There's no such thing as just cracking, whack them and crack them and send them down the road. That's not the type of chiropractic care that I do here. That does exist in chiropractic, but that's not the type of care that we do here at South Metro Wellness. We're looking to remove subluxation and repair the joint. So when you do a chiropractic thrust, is what it's called, you are removing subluxation and you're taking the stress out of a joint. When you take the stress out of a joint, you hear that popping or clicking sound. It's going to sound loud because it's up close to your ear, especially if you're getting a cervical spine adjustment. That is the sound of the gas being released from the joint. Bones don't crack, joints don't crack, cartilage doesn't crack. That crack or pop or click, it's a sound that you audibly hear. It's an audible release that comes out of the disc space in your joint, which is right in here, the part that keeps gas, and it releases that gas and it sounds like a click, crack, or a pop. Okay, the bones themselves are completely safe, the joints are completely safe, the nerves are completely safe. Chiropractic is one of the safest forms of healthcare on the planet. If you look at what my cost for malpractice insurance is, it's like 1/50th of what it is to be certain medical doctors, anesthesiologists, OBGYN. I think they carry the highest level of medical malpractice. Mine's like $1,400 a year. Very, very, very low. And in 10 years, I've never had an incident. And in doctors I've known for 20, they may have had one incident where something did not go correctly and a patient had a pre-existing condition they just did not know about that would have been very difficult to detect. So those are some of the very, very common myths that I feel we've debunked today. If you start coming to a chiropractor, no, you do not have to continue for the rest of your life. You're going to get great results. Just keep in mind that if you do not maintain those great results, you will eventually lose them and your body will slip back into the way it was. Just like if you don't wear a retainer after braces, you'll end up going back to the way that you were. The sound of the joint is normal. It's expected. The adjustments do not hurt. They're actually painless. If an adjustment does hurt, it's the surrounding tissue that was already inflamed that was sore after an adjustment. If you do experience soreness, it's very, very common. You do put some ice on the joint, 20 minutes on, 20 minutes off to take some of that soreness down. Some people prefer to use ibuprofen. I don't tell people to do that, but I don't tell people not to if they need to. Cure, once again, there's no such thing. It's total recovery if you're able to meet that. And the longer you wait and the longer you keep a condition, the less likely it is that you will make a total recovery. That's why it's important to get in to see a chiropractor right away, especially if you were in an accident this weekend with a 1/2 inch of ice over on all of the roads that we saw documented on Facebook videos this last week. And when it comes to chiropractic or chiropractic care not working for you, there is a wide variety of chiropractic practitioners out there. It's very, very possible that the practitioner you went to just may not have been a good fit for you, or maybe there are some holes in the education process or the interview process. And keep in mind that you have every right to call anybody in your area and say, hey, can I come in for a free consultation? I'm looking for a chiropractor, but I'm not ready to be committed. And that's perfectly fine. Most chiropractors would be more than happy to meet with you and have you be a patient in their clinic. And if you're not happy with the interview process, go on to the next one. Very, very simple. There are going to be several more myths, but that's going to be for Thursday's video. We're not going to be able to cover all of them today. There are that many, and this was a very important topic and a very important video. So with that, once again, Happy New Year's Eve. I'm so thankful that you tuned in today. We'll see you in the new year. Our next video will go live on January 2nd on Thursday. If people make it to work that day, I don't know, you might still be in party mode or recovering mode or winter break mode, what have you. But we will be here once again bringing you more information about our bilingual chiropractic practice chat that will be also included in the next video, as well as some other interesting information about debunking myths. This next portion, video part 2, will be discovering how insurance care works with chiropractic. The insurance climate has changed a lot, and it's going to be difficult for people to grasp all that. It's still difficult for me as a practitioner to grasp all of that. So we're going to go over that portion. We're also going to talk about making chiropractic affordable for you, your family, and as well as auto accident insurance and workers' compensation insurance and how that works as well. So, a lot of information today. We'll see you guys on Thursday. Thank you for tuning in. And with that, happy New Year.